Hi, and welcome back to the Spark Study Club podcast, where we bring you relevant clinical information you need for success. I'm your host, Melissa Turner, and today we'll be discussing best practices for bone regeneration. We do have an exciting virtual webinar coming up on September 10th at 7 p.m. Eastern, and this course is taught by Dr. Bob Miller. I was gonna call you Robert, Dr. Bob Miller, and we'll cover next generation GBR, predictable regeneration with OraGen for severe bone defects. It's brought to you by Salvin Dental Specialties, and you can go ahead and register at sparkstudyclub.com. Please know we do have limited seats remaining. So we wanted to take a couple minutes today to help you get to know Dr. Miller and give you a sneak peek of what he'll be discussing during the webinar. So Dr. Miller, thank you for being on today's show.
And thank you, Melissa, for having me here today. I really appreciate the opportunity.
Now, for those who don't yet know Dr. Bob Miller, but you have been around a while, so I'd be surprised if there's anybody. He did receive his dental degree from Boston University in 1984, and then he went on to receive his Certificate of Advanced Graduate Study in Perio from Boston University. So I love you already as a hygienist. There we go. And he maintains a private perio practice in Plantation, Florida for over 30 years. He's lectured nationally and internationally on implant and guided bone regeneration. He's an active member of the Academy of Periodontology, Academy of Osseointegration, and the list goes on. He's a fellow of the International Team of Implantology. So let's dive straight to the point. Guided bone regeneration is not new. And you and I were just talking about technology before how technology moves at the speed of light, speed of sound. It moves fast these days. So GBR is not new. It's been around for decades. It's a part of who we are foundationally as an industry. But why is it important to talk about it now? Let's start there.
Well, it's really interesting when you sit and think about guided bone regeneration. It has its start back in the late 1970s, early 1980s. Jan Linde, Stuart Niemann, all were big contributors to the concept of guided tissue regeneration. And what's really fascinating about guided bone regeneration is the fact that a lot of the principles that we used back then are still relevant today. And if you sit and think about it, things have changed clearly. Our techniques have improved, our biomaterials have improved dramatically. But the really interesting part is that a lot of the principles are still the same. And some of the newer materials, like OraGen, which is coming out, is changing some of the dynamics that we took for granted back then that couldn't be improved and now are actually improving.
I feel like that is almost the story of other things in dentistry as well, not just implants. You know, the technique is the same, the foundation is the same, but now we can take it farther. So what else in your mind, what else has changed in the implant process? What else has changed dramatically? You mentioned materials.
Well, I think biomaterials have improved. Well, if you're thinking about the bone that we're using today, OraGen, for many, many years, autogenous bone was considered the gold standard. And now we're finding out that the OraGen, which is a cellular bone allograft, is actually synonymous. They work they work the same. You're getting the same results. A lot of us are even experimenting without even having to use a barrier membrane. It's interesting. When I think about guided bone regeneration, I think about the race between the turtle and the hare, the rabbit and the turtle. Bone being the turtle, meaning the slower growing of the two, and the barrier membrane actually impedes soft tissue ingrowth, which is the rabbit. So that for years, that was the model we kind of thought about guided bone regeneration. Now, hey, why not juice up the turtle? Let's make that turtle run faster. And that's what some of the biomaterials are actually doing today. And what we're finding out is that, maybe it's true that you don't necessarily need a barrier membrane. Maybe it slows down the signaling properties of the OraGen, the growth factors, the osteogenic potential that we really didn't have with some of the older biomaterials. there was no osteogenic potential. Now we have that as a potential, which is juicing up the turtle. So again, a lot of these biomaterials are they're improving upon the principles that we took for granted for so many years.
Mhm. Now, if someone wants to implement OraGen now outside of the membrane, what other differences as far as placement, uh, long-term growth, is there any other difference or user change that they have to implement?
It actually I often joke about when you're using particulate bone. It doesn't have the hydrophilicity. It doesn't, an OraGen you can roll up in a little ball. It's so easy to use, and it's very easy to make dents. And I just think ease of use and and just how it's easy to implement in your armamentarium.
Mhm, mhm. So, with that said, we know the bone has to grow to have implant success. If you could narrow down maybe your three top tips to ensure success on implants, what would that be?
Well, I say my big three top tips are number one, being aware of the defect you're trying to resolve. In other words, case selection is extremely, extremely important with just about any type of procedures you're doing and implants. Selection is number one. Number two is also being open to new products. Okay. And it's really interesting when I've been involved with different bone products for several years now. I used to teach the allograft bone ring course pre-pandemic. And I used to advise my the people who came to the course to not necessarily throw it at the most difficult case that you can possibly imagine. Okay, and then when in the back of your mind, if you say to yourself, "Oh, I don't know if this is going to work," and then you throw OraGen at it, or you throw another biomaterial that you're considering, I I think that's you're destined for failure if you approach it that way. I feel that you should do procedures that are well within your wheelhouse and okay, do something that's relatively predictable, and I think you're going to enjoy success. And then add it to your armamentarium when it comes to these types of procedures. Okay. The lastly, let do is never forget the basics of any procedure. I often when I teach my residents, I often refer to the basics, the ABCs of things, and sometimes they forget it, and people don't forget the basics that you have to have if you want a successful GBR procedure. Things have to be stable. Okay, if you want a successful implant, the implant has to be stable. Okay, and a lot of people forget that. So I think those are the best three tips that I can give anybody when it comes to implant placement and guided bone regeneration.
Mhm. So start small. Don't forget the basics. Don't imagine magic on the biggest case you ever you ever worked. Don't start there. Right, right. I'm curious though.
No.
I'm curious from your perspective, what are the most common defects that you're seeing these days?
It's really interesting. I post COVID, people sort of took a holiday from dentistry. And so I was getting what I almost laughingly referred to as triage coming into the office, all broken teeth, just an absolute mess. And you were reacting. You weren't like, you didn't have time to treatment plan. Everybody's hair was on fire. I always prefer to get my cases and be proactive about it before it's a disaster. So we're seeing a lot of disaster cases coming into the office these days, and which really, most of these cases now, since they've had advanced infection, actually wind up excellent candidates for guided bone regeneration. It's interesting, as being a periodontist in a not a large community, but a medium-sized community. Um, the cases that come to our private practice are not the slam dunk, people who have yards of bone. Uh,
Yeah.
and I almost like laughingly think to myself, what do I do most of my day? What I do most of the day right now is actually grow bone to come to my practice. Usually either have horizontal, vertical bone defects, or broken teeth, and bad infections, things like that. So I, the cases that everybody, oh, look, you just throw an implant in there. Well, that's not the ones that are coming to my practice. So I think to establish a successful private practice, one has to be proficient at guided bone regeneration, and that's what separate anybody can put an implant in a site that has no defects and plenty of bone and good density and things like that. So for me, I'm getting all the cases that need horizontal and vertical augmentation. So we're using it a lot for our sinus lifts, things like that. We're using it for both horizontal and vertical augmentation. And now that Salvin's introduced a smaller size of the OraGen, you can even use it for relatively just regenerating a buccal plate, for instance, things like that. You don't have to worry about having too much bone, and wasting it. So I think that there's a lot of opportunity to use this product.
hmm So let's talk about the future then. Let's say 10, 15 years from now, where do you think all of this is going and will go? Predict the future, right?
Hmm. Yeah, let me see. Well, my crystal ball is generally, I'd rather predict the stock market tomorrow, but if you're going to 10, 15 years, well, it's really interesting. My background, what I and we don't have time to go into the whole thing, but I've often thought, 15 years ago, 17 years ago, when I first started kind of really looking at guided bone regeneration, I often thought to myself that whole concept of juicing up the turtle, using different biologics and growth factors in the bone grafting material. And for like when in the 1990s, we used to send out to the hematologist to get cores of bone to use for periodontal defects, and the whole thing seemed to be a big deal. And then harvesting autogenous bone, a lot of patients really don't want two surgical sites, and we all know that. Back then the gold standard was autogenous bone, and you have to present that to the patient. But you get a lot of well, for lack of a better word, I ain't doing that. You're not going to my chin. You're not going to my tuberosity. You're not going to my ramus, and forget about the external sites.
Yeah.
And I often say to myself, where do you get, I see these patients, where do you get all these patients who are, open up my hip and harvest some bone? It just doesn't happen that way in my world. So I often thought to myself, well, what might be the next best thing? And I often thought that the concept of some sort of addition of some biologic maybe to and we tried that with a number of different products, and we've had varying degrees of success.
Mhm.
Wasn't always successful, to be quite honest with you. And I guess my eyes really opened up when I started talking to the people at LifeNet, and they kind of came to me with this concept, knowing that my background in trying to grow bone, and they that to me was a pretty big day, I would say, a very big day for me. And it sort of opened my eyes. And the more now that I've used it for close to a year and a half or so, and I'm actually enjoying the successes with it, which actually I'm going to show everybody on that's sort of the little advertisement here on September 10th. I'm going to show you how I'm using OraGen successfully in my practice, which is actually pretty exciting. And so again, I urge everybody if they have some time to kind of tune in on to that webinar.
Mhm. We can never have
But
you.
as far as the future though, I just I just see more and more and more success. And this concept of being able to grow bone more predictably is
Mhm.
going to, number one, expand the availability of dental implants. In other words, there are so many people right now who I consider what oral invalids.
Mhm.
They just they're train wrecks. And now we can sort of right that ship for them. And I think that's really exciting for the profession.
If we can predict the therapy, if we can personalize the therapy, I mean, that's where all of healthcare is going. So I tend to agree with you. My crystal ball says you are spot on for what that's worth. Okay, so Dr. Miller, where can listeners find out more about you?
Oh, that's a good question. Where can you find other? What do you want to know here, Melissa?
We
Find
want to
out
know
about,
everything.
you
So,
want to know
how can they
everything. Okay.
contact you?
Well, you can contact me at my email address, which is drmiller at webperio.com. Dr. Miller is one word and then webperio, one word.com. And feel free to text message me or no, feel free to email me and I'll be more than happy to respond. And when you do watch the webinar, I will post that as well. And feel free to, if you don't get a chance to ask questions, but I like to make these webinars as interactive as I possibly can. And I do not discourage, I love the back and forth. Brad McAllister is going to be the moderator, so it should, he's an expert as well, and it'll be a lot of fun, and you'll definitely get a lot of good information from that.
That sounds great. Well, Dr. Miller, thank you for being here. Thank you to everyone who is listening. And don't forget to go ahead and register for the fun and free webinar at sparkstudyclub.com. And we'll see you then.
Thank you, Melissa, and thanks for having me.